Welcome to the program. My name is Marty Shenkman, and I'm joined by a really very smart colleague, Dr. Brian Dooreck. Interesting guy with some very interesting thoughts. This webinar is a little different, very different from the ones I've probably ever done before, but I think could be very important, but from two very different perspectives. First, we're going to talk about healthcare in the context of why all estate planning professionals, whether wealth advisors, attorneys, accountants, what relevance this may have to our practice and how we help clients. But there's a second aspect to this that I think is really interesting and really important, and we may not directly talk about it, so you may have to kind of read between the lines. But what Dr. Dooreck is going to talk about is really just another dimension of how advisors in all fields can better serve high net worth, high touch clients. And I believe that really most of us, even if we have, more moderate clients for bread and butter, so to speak, for many of us, having the right services and the right touch for those high net worth clients that want the red carpet service, that want holistic, broad based help and want their problem solved, this is something to think about, not only specifically as to the medical issues that Dr. Dooreck is going to talk about, but just in general, how he approaches helping these types of clients. I think there's some valuable lessons for all of us to learn based on what he does and just applying it to how we help the same people that he's helping. So that's it for me, and I'm going to turn it over to Dr. Dooreck. I think you should explain a little bit, just quickly, your background, your company, so people know who you are and the space you're coming from. And then I'll advance the slides and we'll go through the program.
Yeah, so thanks for the introduction. And, look, I think we're all smart. We're all smart people in the room. And the question is, who do you go to when you have a problem or issue about something you're not an expert in? And I think that the smartest people in the room know where to go and who to ask and have those resources available. So look, I'm a physician. I'm obviously a doctor, been doing this for decades. You and I had spoken once or twice, connected, and you got wind of what I'm doing and what we're doing. The background's pretty clear. I trained as a gastroenterologist. I'm still practicing clinical medicine in a different context. But about 10 years ago, I started working with select families through their advisors and family offices and in the Miami area where I'm based, helping them navigate healthcare quicker, faster, easier, and better, more effectively. They were doing on their own than they were doing with their concierge doctors that came to play about 10 years ago. And we'll talk about concierge doctors and what that is and what we do. And even options like Pinnacle Care that Morgan and Merrill and everyone else has access to that are great. And we even help them with cases at times. But, and I'll be honest with you, just to frame it, what we do is, we're not concierge doctors. And just to give you a sense, concierge doctors are great. They're going to provide a doctor's cell phone, a panel of a few hundred patients, and you'll get a Z-Pack on the weekend. We're not doing telemedicine.
Can you explain what the medical world's about? Because it's kind of foreign to me,
Sure.
even though I feel like I'm at a doctor's office, multiple times a month, because I think that'll help non-medical people understand better how clients struggle and what it is that you do.
Yeah, so I do what we do, and I was just to getting clear and clarity of what we do and what we don't do is, we're not doing telemedicine and we're not doing what concierge doctors do, and even big
Explain
companies
what they do though, because so everyone knows.
I'm going to do that right now. We're in a space of private healthcare navigation. We're in a space of patient advocacy. We're in a space of providing a very high touch, privacy and discretionary based level of guidance and navigation through a very challenging system. And I'm going to explain to you why this system has become so challenging.
Yeah.
There's a reason why we've been called medical Sherpas, healthcare problem solvers. Let's just go back to the basics. We're talking about medicine. It all starts usually with a primary care, an internal medicine doctor, MD, or a family practitioner, which may be a DO, an osteopath, or a pediatrician of some sort. That's your general doctor. What's happened today in today's world, and a blind man in the dark knows that the world is changing, that the healthcare game is changing. We are seeing more and more, I would say, middle class, upper middle class, rich in the eyes of, the one, whatever, are getting boxed out of the healthcare system. Why? Because doctors are no longer able to stay in practice to provide general primary care based on the current reduced reimbursements, the increased overhead, the increased cost of doing business, and are being forced to go to a concierge model, which you've heard of MD VIP or MD squared or Signature MD, or companies like Private Medical, which you can read about, are doing $40,000 an adult a year, $25,000 a kid for concierge medicine. This is what's become in the healthcare industry. People are losing access to primary care because doctors aren't able to stay in that, single, hang a shingle business. They're getting bought up by a hospital system. They're getting bought up by a healthcare system. They're being forced to merge, or they're being forced to say, I can't do this anymore. I'm going to limit my practice to 400, 500 patients or 200 patients, and I'm going to charge each patient, maybe it's $1,800 in the middle of America, but it's, five or $10,000 in Miami Beach, 15 to 20 sometimes in New York.
And
I
what does
mentioned
somebody get for
40,000.
that? What do you really get for that?
You Whatever you want to be told you're getting, but in the end of the day, you're probably getting the ability to get access to an appointment, a same day appointment. Maybe you got valet parking. You're going to have a doctor's cell phone number, and you'll be able to call that doctor on the evening or weekend and probably get a Z-Pack or an antibiotic if you need it without this. But what we've experienced and what's become a reality, and I could tell you the truth, the harsh reality, being a specialist, and I've spoken to concierge doctors in New York City and in Miami, where we're based, where people are paying $10,000 a year for that, but they're stuck because they don't have the same access to the specialists that the patients are getting to themselves as primaries. So they're there in a situation where they have a high pain, high touch patient who's expecting a high level service. And they're like, oh, I got a great cardiologist for you. You need a colonoscopy, but they don't have that same level of access into the private practice and specialists. Now, when I was in practice, in a high volume practice in South Florida, I created like a GI VIP model. I saw this opening and need for these primaries to create access points for certain patients. The reality also, concierge medicine from our experience is, the response is typically located based within the epicenter of their world, their system, their hospital, their community. Oh, I got the best cardiologist for you. He's across the hall. Oh, I got the best, gynecologist. She's across town.
What if I'm traveling?
Yeah, well, what if when things get real? Let me give you the other inside harsh reality to healthcare. Hospitals do many things, but they're not great at everything. And a good hospital doesn't always mean you get a great doctor. And when we're dealing with clients and the client households we work with, it's kind of like saying, Kobe and MJ were the best basketball players you know, but you still got Phil Jackson on the sidelines. Because you could be on the court, you could have the ball, you know where the net is. You don't put the ball in the net, it doesn't mean anything. So yes, for bread and butter routine things, it's probably fine staying within the community. But sometimes when things get real, when the world goes upside down, when your blueprint for life gets ripped up, or your winter's here moment, and believe me, that happens. It happens to all of us. I see it over and over. And believe me, I'm 54. I'm having some real understanding more and more, not only in a professional sense, but also in a personal sense between people in my life, friends, colleagues, family, on how fragile and how quickly the game can change. And so when things get real and things are, do you want to have a higher level conversation than with someone local? Do you want to bring in, I'm going to get better lighting for you here. One second. Do you want to have a higher level conversation in something like that? And this is the kind of things that we do in the space that we're in.
Brian, let me just try to understand a little more of the playing field. So people can go to whatever regular doctors they can get through Medicare or their health insurance, the local hospital. Concierge is something that's supposed to help them for a fee on top of everything else,
Mm-hmm.
get better access and more personalized care. And you've kind of painted out a little more of a realistic picture of that. What is telemedicine? And you mentioned Pinnacle is something different than both of those. What are those and how do those fit in?
So telemedicine is basically what's become more prevalent in the COVID era. The ability to schedule an appointment and have a virtual visit with a doctor or nurse practitioner or physician assistant, the latter being physician extenders, which is a reality becoming accepted that you're not even seeing a doctor half the time, but you're seeing a physician extender. Telemedicine's fine. I never embraced it myself as a gastroenterologist. I always want to feel someone's stomach, or I want to talk to them and feel their energy in the room. It goes a long way in the human connection. People use it, especially in rural medicine, but there's a role for it. But to me, it's not the real best solution. Having a human relation. Pinnacle is a company I mentioned.
Wait,
It's a very yeah.
before you go to Pinnacle, what do you feel that the ultra high net worth clients, are they even willing to engage in telemedicine? Is that something
Yeah.
that
Everyone has different needs and different wants. I mean, if you're asking me what the ultra high net worth clients want, I'll tell you exactly what they want. We decided early on two principles. One is we're going to bring value forward on a platform like LinkedIn on how to navigate healthcare. Because if we don't share value on how to navigate a very challenging system with our decades of clinical experience, we feel it's almost criminal. That's the first principle we decided. And the second principle follows your question. We decided early on that if we scale beyond the ability to be doctor facing, if we scale beyond the ability to have a client household conversation like we're doing now in this time of day in the afternoon, then we scale beyond the high touch our client service households want. Which leads me to answering what do people want? What do ultra high net worth households want? I'll be honest with you. Technology, all this stuff, we realize no one wants portals. They don't want apps. They don't want 800 numbers. They don't want social workers, medical assistants, and levels of friction. They want this. They want a conversation, a human understanding. They want feeling. They want to know that someone is feeling them and understanding them and feeling what they're going through at that moment. It is a basic human understanding that we are becoming reinforcing on our end every day, more and more, with all the technology and all the tools and all the AI and all the things that we have at our disposal. In the end, we're going back to what is at core essence, substantive and tangible. It's the human feeling and connection of understanding. Look, it's a very powerful thing, that I personally and we share when we get on a call with someone on a Tuesday night or Saturday morning when they're in a dark, scary place. And when you're the family office principal, when you're the trust and estate attorney, when you're the CPA, when you're the advisor, and you're getting wind of a situation where something has gone sideways in someone's life, or you're getting wind of a chronic situation that as you become friends with your clients, and we know 80% of the conversations in your audience's world with their clients is probably not about money and wealth. It's probably about life and family and the kid's addiction or their wife's breast lump or the depression or the anxiety or dad's Alzheimer's, et cetera, et cetera, et cetera. And we know that when someone's in a dark, scary place, and when that state attorney, when that family planner, when that advisor, when the CFO, when the family office principal is making a connection to us, and we get on the phone with someone and we introduce ourselves and have a conversation with that level of privacy and discretion that we work in. And I share with them 4 words that I don't take lightly, put a lot of weight to. And to share with them from my position, from my shoes, to tell them 4 words, you are not alone. It's a very powerful thing to do. And when you're in that position of making that connection, you just bought generational loyalty. And we see it over and over. So that
let
is
me
what
just
people want. That is what people want, though, in the end. They want to hear, they want to know, they want to feel and understand that they're not alone.
I just wanted to add, everything you just said is exactly what I believe the clients that estate planners, whether attorneys, accountants, wealth advisors, insurance
Mm.
consultants, it's the same thing. When they have something bad going on, and it could be anything on the list you said and a whole long list of other things, when they're in a dark place, when they have a problem, they want a human being, they want someone available, they want to know someone's there to help them. No matter what you can do, they want to know someone's there. Exactly what you just said. So just to emphasize what I said in the introduction, I think a lot of the concepts that you're bringing out, we don't talk about enough in estate planning, but they're very real for what we do. Let me
100%.
turn you over to the slide deck, and
Sure.
maybe you can go through it, and I'll advance them as you tell me to. And if I'm too slow or fast, just yell at me.
Okay. I won't yell. I'm not a big yeller, but I think this, this slide we talked, you and I talked a little bit when we spoke, and the estate planning's, the space and the demographic of who we're speaking to today. You know, what are the areas and things you touch on? I'll be honest with you. Look, I know what everyone's doing in this space, and I'll be honest with you also. We studied this world of ultra high net worth wealth management and all the aspects of it from the outside, not from the inside, from the outside for about 5 years, and we look at it every day. And we look at platforms like LinkedIn, for example, the higher bandwidth platform of social media, and we see the redundancy of what everyone's doing. But everyone's doing the same thing. If you're in estate planning, or you're in financial management, or you're in ultra high net worth, high touch services, and you don't deal with wills, estate trust, tax planning, security, or cybersecurity today, you're behind the curve. If you deal with wealth management and you don't talk about Bitcoin, you're passe because David Solomon and Goldman talk about it. I'm telling you, no one really yet in the world of ultra high net worth wealth management is dealing with the most important piece of truly comprehensive management, which is health. Now, people dabble in it. I know what everyone's doing. I know who's on the 30, who's in the end zone. I know what people are doing. I'm telling you, there's a big gapping void in this space in the comprehensive management of estate planning, of trust planning, of wealth management, because no one yet has been dealing with the most important variable, the biggest differentiator post-pandemic. This is what captures attention. This is what is sticky. This is what matters most to people. It's why Marty, I tell you honestly, those in the world that you're in, of your audience today, that are not having this conversation or listening to this with intention or not aware of this already, they're falling behind and losing market position. Period. It's like Wayne Gretzky says, I don't skate to where the puck is. I skate to where the puck is going. This is where the puck's going. People are moving there. I'll be honest with you. I know if I go over the list of the conversations we've had in the last 2 years and the meetings we're currently in and the discovery and the clients we've taken on and continue to take on, it's mind blowing on how this paradigm and how this world has shifted. And if you need to be aware that today the world is changing, big picture stuff. I think the challenge, I think we talked about, in terms of financial managers or in terms of estate planning, it's you and I, Marty, you, me, and everyone who's listening, we speak one currency today. It's one currency. It's called attention. And the truth of the matter is, when you're in the world of financial management or you're in the world of estate planning, you're sitting across the table from a client that has 10 million cash, 100 million assets, whatever it may be, and you're trying to hold their attention today for 3 minutes. Good luck. It's hard. If you start mentioning health and healthcare and private healthcare navigation, it captures attention. People, it's sticky. People get it. And it's why in 5 years, we're closing the doors. Our firm, we'll have about 5 firms, family offices, boutique groups, and about 10 or 15 households. Like that's what we're doing. I'm 54. I told my chief surgical navigator, chief of plastics at a leading institution in the middle of America. I was at Hopkins and MD Anderson, Pittsburgh, medical advisors, Duke and Cornell trained. I told these guys, we're not growing this business to 100 million valuation in 10 years. Like Marty, I'm 54. I'm not going to grow this thing in 10 years, pop it, have some big exit and get sick. I see it every day. I'm not doing it. So we really become intentional about the right partners, the right families, and really fixated on integrity-based relationships. It's kind of why we're so selective busy. I think it's why we're speaking today. I think as you and I spoke, you understood what your services, high touch service offerings needs are in the trust and estate and tax and planning world, how it all kind of ties together. People use the word holistic. It's a little overplayed, the way they use the word concierge, the way they use the word coaching. These are today, family office. Talk about a word that's getting diluted. These are words that are all being diluted. That's why we don't use concierge in our description, title, or anything. We're private healthcare navigation because we want to stay away from the dilution. And I think that your audience knows that if they're not differentiating their high touch service offering, what they're providing their client households, they're going to get more and more diluted and more people that say, I'm an estate planning. I'm in trust in estate planning. I'm a family office principal. I'm a whatever. I don't know if that makes sense to you, but that's what we see from the outside.
Everybody does estate planning now. Every financial advisor practically does estate
Yeah,
planning. And what
correct,
is it that they do versus the lawyer versus the wealth, the insurance consultant? Everyone's an estate planner. And
correct,
I don't know that clients can discern what the difference is of what many of them are offering.
correct. So it's the same thing, it's, how do you differentiate the services? How do you differentiate the options of medical care, telemedicine, concierge medicine, all the different few companies out there that do what we do. It's very straightforward to us, what the differentiations are, but it's not clear. It's
When you
you know,
allude to companies that do what you do, how would you describe the niche that your firm is in generically so that somebody
yeah,
can look into, who else is doing this and what the industry is
yeah.
about,
I
the
mean, I'll tell
segment?
you, it's healthcare navigation, and I'll tell you, Pinnacle Care is a great company. Private medical in Jordan Schlain, based in California, brick and mortar concierge practices, and I don't know, Hamptons and Palm Beach and Miami Beach. Private health management in LA. Black Bag Medicine. I give you the five. We all sit on the health and well-being domain of the Ultra High Net Worth Institute. The point is, what we're doing in my world, which is the only world I really care about, and I work with everyone, we help each other out as needed, is, we're not limited by geography. We're not local, we're not regional, we're not national. We're kind of global at this point, working with clients in the UAE, Switzerland, London, etc. And like you mentioned, what happens when I travel? Well, I don't know. I'm sitting myself right now outside of Aspen doing some clinical work this week and having some family office meetings here. And I'll be frank with you, your concierge doctor in Chicago is not going to do a whole lot for you when you're, at Valley View Hospital in Aspen, or you're in Jackson Hole. And we see it over and over, and I was dealing with clients in Salt Lake City today. We are not limited by a system. We're not locked into one system like, oh, we got the best people here. Goes back to what I told you. It's goes to another quote we kind of refer to, and I'll be frank with you, it's the truth. And your health is not always your decision, but how you handle it is. And we're highly proven in acute crisis intervention, emergency room visits, urgent care, cancer, ICU, things happen. But one of the areas we've become highly proficient and effective and focused on is prevention and planning. And I'll give you the reality of, the harsh reality to healthcare again is you and most people you know, are in a low status position in the eyes of physicians. And I'll tell you why. This gives you this little roadmap gives you exactly what we do in our process of organizing records, planning appointments, having confidential calls, preparing for those appointments, and creating the access points with ongoing communication between doctors, with ongoing accountability. Before our call today, I put 3 phone calls out personally myself to a sports medicine doctor in Salt Lake City area, a primary care doctor in Little Rock, and a specialist, a motor neurologist in Phoenix area, for 3 separate clients, requesting records from their appointments this week and last week. And I think within 30 minutes of calling those 3 offices, I received 3 faxes with the notes, labs, and records to update their files to have our follow-up planning calls tomorrow. But going back to the reality of the game, that kind of sums it up too, is that you and most people probably can't get hold of an office manager in a week. We can get hold of most doctors in 12 to 24 hours, was able to secure 3 sets of notes on 3 separate offices within 30 minutes today. But the reality, and why I could tell you this from experience, is that when I was in practice in South Florida until last year, I left my practice after 19 years as a partner to give this company the attention it now requires. People are waiting 3 to 6 weeks to see me, standing in my waiting room, holding records. They don't know what they mean, standing in line, doing $100 co-payments now, sitting down, bringing ball to another room, holding records like Chinese to them. And after 20 minutes waiting there, I walk in a room, it's like, hi, hi. And then I'm in a computer looking the other way, 90 seconds later, typing, realizing they don't even know why they're there. I can guarantee you your trust and estate planning, colleagues and their families that they work with aren't going to board meetings, mergers, or acquisitions without extreme preparation. They know everything about the buyer, the seller, the market, the cap, the index, the slides, the deck, the pitch cold. Yet people come to the doctor's office all the time where the product or the agenda on there is their health without any preparation. It's the craziest thing.
It's
So we
common.
become highly, it's comically common. It's ridiculous because it's your health. What matters more? What Tony Robbins said once, you don't want to be the richest man in the graveyard. It's just like so basic. So we actually, in our onboarding process, and we work with households, not individuals, but households, and I'll tell you why. We created medical history and summary stories. So when you're coming into the doctor's office, and saying, "Hey, Dr. Smith, hi, really happy to be here with you today. I think Dr. Dooreck or his team spoke to you on my behalf. I think they gave you this, like, here's my 2-page medical summary written by a doctor the way we want to see it, the way we need to see it. I know you're going to examine me and ask me questions, but before you do that, I just want to review some of the outcomes and results I'm looking for from today's encounter." This is what happens. We sit on the chair differently. We'll look at you differently and we'll
When you
treat
say
you.
we, you mean the doctor that they're seeing.
Yeah, 1,000%. Because that doctor who's seeing you already spoke to another doctor on your behalf, saw a summarized medical history and summary written the way that doctor wants to see it, no different than you in your world getting I don't know, financial statement or a profit and loss statement or a balance sheet or whatever it is.
The
It-
analogy is when someone comes into an estate planner, if their wealth advisor put together an appropriate professional balance sheet, you
correct,
way ahead of the curve than if they come in having no idea what they have and guessing at
correct.
numbers, can't remember who owns what. Let
Yep,
me try to draw some points out of what you just said, and I'll just share a personal comment. My wife is a physician. When I go to a doctor for the first time, I take her to the appointment because whenever the doctor asks me questions and I start to explain as best as I can, inevitably she say, let me do this. And using medical terminology and about a tenth of the words that I was using, in 5 minutes or less, she's explained everything. The doctor gets it, and it's a whole different relationship. I think it's really vital, and this is something to draw out of what you've just said. Most people that I know, everything that they have in terms of medical records is in some portal, my chart or another one.
yeah,
They don't even download the stuff because it's in my chart.
yeah.
But what they should be doing is downloading and saving in a rational fashion
Hmm.
all their medical records so they have their own medical history. And when they're going to a doctor, like you said, take relevant records because sometimes they're not, for whatever reason, available or at hand, and have an idea what they're doing. I think at
1,000%.
minimum, and maybe you can add to it, something that advisors, when they bring up a healthcare discussion, can talk about is, do you have all your medical records? I think the answer almost all the time is going to be, what do you mean?
And I would say the medical records are great. And I love the my chart. I mean, it's a common, oh yeah, patients come, oh yeah, go to my chart. Like, are you kidding me? I'm like, I'm in the middle of 22 other patients. I got procedures. Like, I'm not gonna, or here's 900 pages of PDFs. Like, one you need to see
Right.
19. It's take preparation planning are paramount and essential. Having a summarized medical history and medical history summary is paramount and essential to having an effective doctor's visit. Going with preparation planning and understanding what questions to ask in a concise manner, that the doctor is going to feel these are intentional questions where they understand they're going to have 3 questions and it's framed in a way that's not Dr. Google asking them or Chat GPT these days, but it's a conversation of intention, whether you're well thought and you're an interested advocating patient for yourself, not a troublesome patient doctor shopping. All these things lay into it. There's a psychology to the game. There's a process to the game. There's an understanding to the game, and those that are aware of it and those that have the right guidance and navigation through it only have better outcomes and results.
What can people do, advisors, for their clients and even for themselves, that can't that aren't in a position to retain a firm like yours or one of the others that you've mentioned? You mentioned, I think, like five.
Yeah,
What can they do on their own to try to get a better result? I know that's not where you're
yeah.
going and what your firm does, but I think these are important lessons and may have some some ideas of how we as advisors can help clients that are below the threshold of being able to
Yeah.
afford private healthcare navigation.
I mean, it's exactly what I told you. Our founding principle was bring value forward and share value on what we know so well. And every day we post value on how to navigate healthcare on LinkedIn, for example. We share these tips and things. Basic, keep it simple. It's not so complicated. Have a list of your medicines, allergies, past medical histories, past surgical history, your advanced directives, readily available, organized. Have it available in your wallet or cloud or on your phone, or make sure someone has a copy of it. If you have elderly parents in another city and you know, they should have an envelope by the door with 911 EMS written in red on it. So God forbid something happens and dad's hit his head and doesn't remember, or your mom's febrile and confused. They're not going to they're going to take that when they go to the ER and there's have some history and the contact information and advanced directives and who to speak to. They're not going to remember that. Or if dad falls and has this brain bleed and mom's emotionally paralyzed and she's 76 and he's 82 and you're in Chicago and they're in Scottsdale, you know, who's going to be talking to the EMS or the hospital?
Let me
There's,
let me
there's,
interject
there's, yeah,
let me interject a comment on that. It's standard practice for most estate planners to create a healthcare proxy or a HIPAA
correct.
release or a living will or all three or a post.
Mhm.
That being said, what you just said, you said it very quickly. I want to belabor it for
Yeah.
a second. Having an emergency envelope is critical for people with health issues or as they get on in age, for people that are living alone. Having in that envelope not just a copy of your healthcare proxy, living will, whatever healthcare documents, but also a list of your medicine. I have a chart. I type it up as a simple Word document, and I list every med that I'm on, how much, what it is, when I take it,
Hmm.
and if
Yep.
it changes or if it's removed, I move it to the bottom of the chart so
Yep.
they have a prior history if they want it.
Yep.
And I actually, just for my sake, not for the doctor's sake, indicate which pharmacy or mail order we get it from, because
Yep.
sometimes we get them from different places because of the cost differential. But I have a one-page summary of every
Yep.
med, every vitamin, every supplement that I take, because sometimes the supplements are things they want to know about.
Spot on. I mean, you're
And
it's 1,000%. Listen, you're taking a step forward that is a world different than most people.
but
What you're
this is
doing
stuff
is,
that
of
we can advise and encourage clients to do without being
course,
medical experts, because it's
course,
it's it's
it's
almost
common
common
sense.
sense.
Common sense. Common sense. Like you don't go to a meeting on a business proposal without having a complete business plan reviewed over 9 times.
Right.
How do you go to a doctor's office and not even know your past medical or surgical history with relevant dates? Was your last colonoscopy with polyps? What was the follow-up? What was when's the last time you had blood work? I mean, there's a reason why I go back to, we talked about, I mentioned Scottsdale and Chicago. Why do we work with households, not individuals? Why households? Because in our world, you're our client in New York and your daughter's at school in Boston, or you're a client in Chicago and your mom's living in Boca Raton and she's in the ER with a broken hip, or your daughter's intoxicated with COVID or appendicitis in the ER at Boston University Medical Center. Who are you calling at BU Medical Center or Boca Regional East? No one. No one. That's why you're calling us. So we work with households, and there's a reason why. And we work with firms because why firms? Because they need a market ready solution. They need a push button solution when they get that call. Because when the roof leaks, where the kid can't get into USC because the side door is closed, they don't row and don't have Photoshop, the first call is usually going to the family office advisor, the high net worth advisor, the trust and estate attorney, or any other high level planner in their life. That's the relationship. That's the first call. And when you don't have a solution to something that comes up in the health space, and you're scrambling to say, oh, who do I know in the country club? Who do I know in the church? Who do I know in the synagogue? Who do I know in my client Rolodex? That's who do I know on the board at the local hospital? That's dabbling. We don't dabble. You don't want to be dabbling when you're dealing in a high touch client world and now an ultra competitive market more so. Forget the fact you're not even providing the highest level service. You're not keeping up with the level of business that you need to be competitive in today's market. Yes, you want to do the right thing and take care of your clients, all these things. You need to be doing this stuff now. You need to have solutions on the ready. It's not about maritime insurance, aviation insurance, or planners, where to get the best jet rental from, or the best wine or watches. All that stuff's fine. That's great. Those are great variables and add-ons to have. Everyone has those, but it's the health is what matters. What's sticky, it's what matters most. It's what, again, buys generational loyalty. When you can deliver solutions, not only in acute crisis intervention, but to be ahead of it with prevention and planning, that just aligns with what your whole professional space is about. Estate planning, prevention, planning, keeping clients alive with a quality life and longevity. That's what the game's about today.
I think even at minimum, the things that we just talked about, where I tried to highlight some of the things that Dr. Dooreck said, are steps that we can all take to get clients better prepared, more organized, and have better control for any level of client. And I don't know that people are having those conversations with them. I knew to put
Probably
together a
not.
list of my medicines, just I don't know how. But the history, these things can all be summarized and can all help a client. The silly sounding thing of that 911 emergency EMT in red on an envelope, pasted on the fridge or where with a magnet or whatever. Lots of our older clients need to do that. And I bet most of them haven't.
Can guarantee you most haven't, and I can only tell you because I've trained in New York City, I trained in Miami, I trained in university-based hospitals or trauma centers. I've seen it all the time. My mother has advanced Alzheimer's in 80 something. My dad's 85 and still hiking and doing yoga, but I see all spectrums. I see it every day. I'm telling you, this is what we do. We see it. We've seen it 1,000 times before. And those that are not paying attention to, when you said he's a smart guy, you're a smart guy. We're all smart guys. But I'm smart enough to listen to my lawyers and my accountants and my bankers about things that they're experts in. I'm talking about what I'm an expert in today.
Do you want to comment at all on the slide here?
Yeah, I mean, listen, I think all this stuff is intuitive to understand the basics of what we're doing. The role of what everyone is professionally in high touch services is to have the Ultra High Net Worth Institute, I think, describes it as a wheel and a spoke model. Are you the wheel or are you a spoke? And I think the reality is you need to have all aspects covered. You need to be the wheel, but you also need to have all the spokes covered. And if it's not you doing that spoke, you need to know who's that spoke for that area for you. Because if you don't have that solution for whatever area it may be, you're not going to hold the client and you're not going to preserve that client's relationship and you're not going to be providing more so. You're not providing the comprehensive level of service that I know most people want to be bringing forward.
Let me sort of agree with what you just said from a different lens. I had a conversation with a very bright, very successful wealth advisor at a very large firm. And what he said to me, and I forgot the minimum net worth they need to do all this, but he made some comments that are very similar to what Dr. Dooreck said. He said, clients don't want to deal with having to find an accountant and an attorney and a this and a that. They want to come here and know the issues are resolved. So what they've been doing is folding in more and more ancillary services under their wealth management fee. Maybe some of them they charge for, maybe they don't. I didn't ask about that. But he stressed that the high touch client, the high net worth client, wants to know that they can call them and get issues resolved. And if you see any of the stuff going on in the media, wealth management firms are talking about income tax returns. They're talking about income tax prep. They're talking about estate planning. They're talking about insurance coverage. Whether they do it or farm it out or have, referral to an
Mm-hmm.
independent person, that's where all the professions are going. And that's really what
Mm-hmm.
we've been talking about here is just adding to that.
1,000%. It's why we saw a big space in the area, and that's why we're working with family offices and firms and different things, and why we bring forward, as you mentioned, healthcare proxy. We're very much about white labeling what we do. We're very much about being like the Wizard of Oz, like behind the curtain, and bringing our firm relationships forward to their clients with bringing value in the space of health and healthcare, not providing medical care, but providing the navigation and direction of what's needed. So the things you deal with, DNR, HIPAA, release, what happens when your kid's 18? What do you do to the 18-year-old so they're you still have a decision-making capacity. If they become incapacitated, all the bread and butter things you do, the essential healthcare planning, you could really talk about with a lot more validity having a private healthcare navigation spoke or piece of your wheel, which
By the
is
way,
what we do.
just to emphasize, that's another gap in many families' plans. Kid gets to be age 18, off to college.
Yep.
Anybody think of getting even a power of attorney and a healthcare proxy? I just had a close friend whose child was very sick. They didn't have a healthcare proxy. Kid's 19. Physicians wouldn't talk to him.
Yep.
It's a problem,
Very challenging.
and it's so easily resolved.
Yep.
That's another medical related high touch kind of thing. Just call us when your kid gets 18, or I calendar
Yep.
the dates, call the client, say we got to get a power and health proxy for your kid.
Yep. This is why we have an essential healthcare planning document for our firms to help them understand it. In our core services, whatever. I mean, you can share these deck with your audience, but it's yeah. We looked at for a family office in New York came to me about a year ago. Said, look, I love what you do. I want what you do. I need what you do. I got everything but you. I got aviation, maritime, fine arts, and watches, but not this. But I'm not going to pay for my clients. But I did refer out, I think, like $1 billion of work the year before. That caught my attention. And we looked at it and we said, the average household spends about $25,000 to $30,000 a year in health insurance in the U.S. What does it give you? It gives you a referral, gives you a pat on the back, and gives you some good luck. And you got a $5,000 deductible. So we said, look, that's like playing golf. We'll play golf with you. We'll take you to Pebble Beach. We'll bring Tiger Woods. We'll bring his caddy, and we'll carry your bags. And that's what we do for the households we choose to work with. Look, an MRI for your pickleball elbow could be 3 weeks. For us, it's 3 days. You know, can't get in to see the pulmonary, pediatric pulmonologist for 3 months. They'll see you next Tuesday. Get cardiologist, that appointment in July. I promise you, no one's waiting to July when someone at my level gets on the phone and reaches out to the office manager, the doctor directly. Just doesn't happen. It's just the way the game's played. And it's one thing to many advisors pride themselves on the ability to tap into their network and create solutions in their local, very controlled network of country club, members and friends, etc. There's a much bigger picture to healthcare than that. And that's dabbling in how to have these solutions.
I
Um,
think
you know,
I think we've covered all this.
yeah, I think, we touched, these are just a bunch of slides with different optics about presenteeism. Honestly, this is not the core of the conversation for me. The core of the conversation was how do we bring value forward and share. These are just some slides of talking about differentiation of how we're really, really good at healthcare. We become very good at marketing and how we share with some of our firms the ability to go onto LinkedIn, for example, and say, hey, look, we focus on what matters most. We offer access to private healthcare navigation, their colors, their logo, their brand, not us. So it's one of the things we do for those that we work with. But I think honestly, the point of the conversation to me more was about bringing value forward to an audience of smart people in the room about an area that we're experts in, navigating healthcare, to an audience, a group of people that not only need to know it personally for their own lives, but to bring the highest level of service to their client households, prospective, current, and future. So that's the point of the conversation today. Also, you can share the slide deck if you want on your website or
I
whatever
will.
you do. But it's really more about bringing value forward and hoping to, if people walk away from one thing, it's to know that there are high touch services like ourselves there, and also how to pick and pull from us by the things we post on LinkedIn, example, or other, share openly, or for what I shared in this conversation about
How does
having that
somebody
letter.
find your stuff, your information on LinkedIn? What do they
Yeah,
search?
I mean, executive health navigation, I think the company page there, or you'll see me and my name probably crossing over, and Google us. You could ask you. I think you have my mobile number. I think we spoke the other day directly, but pretty transparent on our website. We're pretty transparent online about what we do and sharing with how we do things and cases. But if anyone needs to reach out, it's always in confidence and privacy and discretion based. And always happy to provide value and share value forward and help give some direction. And if it's a good fit for a engagement for the year or for a firm to engage with us, we're open to those conversations, but we're not for everyone and we're not looking to be for everyone.
Let me try to draw some general
Yeah,
guidance, lessons, take-home points, and you can add to it, and then we can close.
sure.
One of the things, as I said in the beginning, what Dr. Dooreck is talking about, I think, is broadly applicable to what everyone on this webinar does. We serve clients of a wide range of wealth levels, but even on the lower end of the wealth levels, if they're coming to specialists, they usually have a wealth level that's way above, certainly average. It's usually in the top couple of percent, and they want the same high touch that was just talked about. How we can provide that high touch in the areas that we work in, I think, is something to think about, especially with AI and how the whole industry is evolving. Another point, 18-year-olds, kids turn into adults, they need documents. It's a gap in a lot of plans, and a lot of families just don't think of following up. And the individual that I mentioned, a friend that had the same issue, the struggle and difficulties that simple action could have, is caused is horrible. So that's something to talk about. Helping clients get their medical records organized, even if we're helping just in a general capacity because they can't afford or don't want healthcare navigation, I think is certainly a value add service. That 911 envelope is a brilliant idea. We should all be talking about it. It should be standard discussions. I'm going to write something in a checklist about that because that should be done. If
Yeah.
you have on the high end family offices, and I actually emailed a family office after we first spoke, and I'm going to email a few more suggesting they talk to you. Maybe this is something
Thank
they
you.
want for their families. But I think there's a wide continuum, wide spectrum of where the ideas that we've talked about can be brought to help all of our clients at whatever levels they're at. Do you have any final remarks or comments?
Yeah, I think, you mentioned once or twice about people being able to afford, private healthcare navigation. I'll just be frank with you, we structure our mindset based around 100-year relationships in our firms and with our private individuals' households. And we're creating 100-year mindset relationships. I won't be here. They won't be there, but I'm hoping that the firms will be there, and that's the goal. And in terms of pricing, we don't deal with people that are typically very price sensitive. But I'm frank with you, once or twice they do. And I'm like, my conversations are simple like this, like, Jim, how much did you spend skiing in Deer Valley last month with your family of four for the week? What would it cost you to go to Club Med next week with your wife? Like, it's priority spending. It's not prohibitive. It's not priced to be like $100,000 per person. It's priced to create 100. We're pricing at this point to creating those relationships. Because like I said, 5 years, we're done. We'll have five firms. It could be a family office with four families, the way we have one in Beverly Hills, and it could be maybe one big flagship store in our block of Fifth Avenue. I don't know. And we've spoken to a lot of the big RAs, and we look. I don't know if it's a good fit. And about 10 or 15 private households. Because after that, it's like we'd rather be meaningful to a few than meaningless to many. We'll share value and hopefully people will pick up and learn from what we do and help people along the way. But honestly, it's like people like, I get in touch with how do you scale? How do you grow? And it's like, we're not about more clients or more likes or more followers. It's like the scalability of trust, more service, more value, more privacy, more discretion. That's it. That's our game. Rome wasn't built in a day. I'm not looking to build Rome. I've seen too much noise, too much craziness every single day. I'm deadpan. We're very, very intentionally clear what we're doing. And having a conversation like this for me, making time out of my day and you making time out of yours is really nothing more. If we help one or two people along the way do something that helps their mom or their client, and we do the right thing, Tikkun Olam, God bless, do the right thing in the world, comes back,
That's
always.
what
That's the way I
that's
look
what
at
we
it.
all try to do.
That's
Um,
it. So,
I want to thank you for your time. I
my
know this
pleasure.
is quite different for my audience, but I think there's some really valuable ideas to glean from this. And I
Yeah,
think there's the whole area of health that doesn't get talked about nearly enough that is worthy of more attention by all of us. So
I
thank you
appreciate
for joining us, and thank you, Dr. Durick.
it. Marty, thanks for your time and stay healthy and I appreciate the time. And again, it's simplicity. The simple things in life is what makes it complex sometimes. And some of the things we talked about are pretty simple. Go prepare to your doctor's office, treat it like any other business meeting. It goes a much, much longer way in terms of effective outcomes and results.
Take care. Thank you again.
Have a good one. Cheers. Bye bye.